Okay, hello and welcome to another podcast episode on host called Beyond the White Coat, the podcast that takes you on an unforgettable journey into the lives of doctors. I'm Dr. Selina. Now, if you have not followed our podcast, be sure to hit the follow button to follow our channel. In today's episode, we'll be exploring doctors in alternative careers. And our guest today is Dr. Paul Chan, who transitioned to healthcare management and entrepreneurship. Now, Dr. Paul is the founder and CEO of Paul Healthcare Group and co-founder and CEO of Sievert Imaging Center and the Director of Eastgate Medical. Dr. Paul left his clinical career in medicine and administration in public healthcare and has been in the private sector for more than 7 years. Thanks for joining us, Dr. Paul.
Welcome. Thanks for having me.
So, Dr. Paul, maybe you could tell your portfolio looks really impressive. How can you tell our viewers a bit more about, your background, your journey, and what made you decide to leave clinical medicine?
Well, after graduation, it all started when I was in Sabah. So after graduation, I opted to work in Sabah. I had the opportunity to work in Kota Kinabalu. Then, of course, our housemanship was only 1 year. So usually after 1 year of housemanship, doctors like us will be likely sent to smaller hospitals at the interior of Sabah. So I was lucky to be given the opportunity in the pediatrics department while some of my colleagues went out to the district. Of course, there was a requirement if I wanted to stay in Kota Kinabalu. I was given 6 months only to pass my Part 1 exams. If I fail my Part 1 exam, then off I go to any of the district hospital. But I got lucky. So after 6 months, I managed to keep my position and a place in KK. So in KK, I worked for 5 years and had the opportunity to be in the first women and children hospital in Malaysia. So in KK, there was a certain subspecialty that wasn't there or available at that time. So peds endocrine was one of them. I applied to be transferred to Putrajaya, the Center of Enterprise Services at that time in Malaysia. I think right now it is also still the Center of Enterprise Services. And the aim of that time was to get more clinical experience so that I can complete my final paper for the membership exams. So there it was in Putrajaya. I got my place, but I felt a little mundane in my work. Spent a lot of time traveling from my house to Putrajaya, and my wife was traveling to HKL Hospital Kuala Lumpur at that time. She was in the local clinical master's program, and she had to rotate monthly from HKL to the university and HKL to the university throughout 4 years. And we had our first child then, and we were struggling to find a very good babysitter for us. So I spent too much time driving from one place to another, and really ended up no time for my son. So he was always the first person to reach his kindergarten, which was at 7 a.m. If the kindy decides to open only 5 minutes past 7, I would definitely be late for work in Putrajaya. So as such, I decided to pivot to management only for one reason: time for my family. And I thought to myself, I was already in Putrajaya, the Center of Administration for the MOH, right? So I should take the opportunity to perhaps gain some experience working in MOH HQ in the headquarters. So in 2011, I got my transfer to HQ, and I spent 2 years over there. Got to know lots of friends and stakeholders for various healthcare organizations, not only in the public sector, but also in the private sector. It was a huge change from clinical to management. I had some adjustment to do, but after 3 to 6 months, I got used to it. And I also took the opportunity to study for my master's for my MBA at the time.
Okay, so, you were already gearing towards becoming a peds endocrinologist, right? So, suddenly with that sudden change, did you feel like, how did you get over it? Did you feel any guilt of leaving the profession? How people always say, wow, sayang lah, you do 5 years of med school, then your housemanship, your whatever training, and then now suddenly, you just give up like that. How did you deal with that?
I definitely felt sayang because after so many years, after 6 years of pediatrics training, but I had a decision to make at that time. It was either work or my family. So it was really a no-brainer for us who have already established families, where family should come first even before work. So it was a decision that I had to make. Of course, felt very down at that time, and I thought to myself, was it a waste of my time, 6 years, or was it a waste of my talent to leave the clinical practice to something that is very, very, very rare at the time? It was 10, 15 years ago, so management was very rare at the time. And so it was a difficult situation on one hand, because I do not know what sort of waters I will be charting over the next, in the future at that time. But over to management was quite, was really a no-brainer. So it was essentially, as I said, just a decide for more work or for family. So I chose the latter rather than former.
So, okay, sounds like for you it was easy to make that decision, which way you were going to go towards.
Yeah.
Okay, do you miss medicine at all?
I do, of course. I do. But as doctors, of course, we still have opportunity to practice medicine, some form of medicine, right? Whether we are in whatever organizations we are, we definitely will have people staying around us, family members, relatives who definitely will come and ask us for medical advisors, ask us to manage them, what sort of blood tests that they need to do, ask us for advice on certain medications that they're on. Well, these are practice of medicine, right? So I felt perhaps even though in management, even though full-time in administration and management, I will not lose the skills of what medical school had given me, as well as for the few years that I had in clinical medicine. But of course, instead of doing 100% clinical medicine, I'm doing almost full-time administration and management. It is a change in role. It is a change in mindset. So I have to change my mind. I always tell my friends that I have lots of hat to wear. So when I meet them, I have a different hat. When I decide to practice some medicine, I have a clinical hat. Recently, I wore a hat as a plumber because one of my clinic's place tap was broken. It was leaking everywhere. So I know how to change tap. So we wear many, many hats, right? So but I made the transition, but managed to to get the transition through.
Okay, tell me a bit more about the mindset. You said that it was a mindset shift for you. How did that happen? I mean, what did you go through?
The change from clinical medicine to management was a huge change. So in my mind, I have to tell myself that, look, I am not dealing with human lives anymore. I'm dealing with organization. So of course, at that time, I didn't know what organization is, but over the years, I realized that dealing with organizations are perhaps more difficult. And I liken it like when we, as a clinician, we are expert in leaves, flowers of a tree, but as a manager or administrator, we are expert in the whole forest. We will have a good helicopter view of what happens from between one tree to another. So extrapolating to healthcare or to management. So when I was in the HQ, I was able to see how different private healthcare organizations work differently, and how all of them have got one role to play at that time was to ensure that the health system, the private health system, remains in check. Right, so the HQ, the ministry's role at the time was to regulate and to make sure that the private hospital players remains to do what they're supposed to do, rather than move away from what are stipulated in the law. So that it was such at the time.
Wow, that's very, very interesting. I mean, like the concept you brought in, how we, as a medical doctor, we're only interested in the leaves and the flowers, but for healthcare managers, you actually have a whole bird's eye view of what's really going on.
Yeah, that's right.
I suppose that's like a natural progression that actually we should be looking out for, right? Because you want to be able to impact healthcare at a bigger scale, as you progress in your career, correct?
Also,
So I remember last time you were saying that you always wanted to start a business. So tell me about that interest and how, what motivated you with that?
the idea of starting business was came out when I was studying my MBA. So we had lots of colleagues who comes from various industries, not only from the healthcare industry. So I see that how passionate they were in their businesses, how passionate they were in doing the things that they do. And I see how most of them started off with just one service or one viable product. So it was at that time I thought, hey, I can do something similar as well, and I can venture into entrepreneurship or business. So it was during my study I started off with one thing. In fact, during my studies, I invested into a logistics solution company called Fluxus, which has got nothing to do with healthcare. It was just trying out and see what I learned from the business point of view, whether it is applicable in the marketplace or not. So it was a technology company and provides a logistics solutions to few MNCs in the country. So essentially, it's like when we go to 7-Eleven, for example, you will remove one Coca-Cola and the next day the Coca-Cola will be replaced. So that's where the solutions comes to the picture. So we started a company. My brother and I started off the company. I invested in that. So the company grew from day one onwards. And that sort of fired up my passion even more. So look, it works, what I study in the master's program, somehow it's not just taught, but it works in the marketplace, So right now, of course, the company is fully run by my brother. And because he's the IT guy, he's the brain behind the company and all. And for me, I just sat back and enjoy, being the minority shareholder. So that was the first one. It was just, sort of like play for fun kind of thing. And with that experience in mind, so I wanted to marry business into healthcare. So that's where Sievert, the idea of Sievert was mooted. Now, of course, my wife was studying for her master's and she is now a radiologist. So it makes sense when we decided to start a company and start a business that relates to radiology plus business together. Right, so we put ourselves in lots of debts and of course use up a lot of our savings at the time to start off the business because, as you know, equipments are expensive. So thinking back right now, we were still wondering how we got the guts, actually to put so much financial risk on ourselves, But thank God, Sievert took off quite quickly. We reached BEP in a few months of our business and we didn't bleed any further after a few months. So it was then we knew that Sievert would grow and it was worth out the risk that we have taken. So with Sievert, then we realized that we have some patients that after coming to us for diagnosis, do not have a place to seek treatment or continuation of care. So Sievert provided screening and diagnosis, and we do not keep medications and we do not give treatment. So as such, we thought, hey, why don't we have some GP clinics, right, to help us manage these patients? So on one hand, we know that the patients has their illness well taken care of after screening in Sievert, and they will not be lost to follow-up. So with that in mind, the Eastgate Medical started, or EMC started. So Sievert provide the diagnostics and EMC provide the treatment. So it was a good model that we thought, and we think that it will develop into a true, integrated healthcare. And with multiple healthcare facilities in the picture, we decided to centralize our management and administrative work into one separate entity. Rather than 3 facilities, we have 3 administrative entities. So we thought whether we have one entity and manage all the healthcare facilities. So that's how the PHG of Healthcare Group started. Essentially, it is a management or HR company to manage the facilities that we have. So over time, we had more facilities, then PHG will manage the human resource, administrative role, etc. Then we realized after that, there are clinics or there are healthcare facilities outside that wanted the service that we are actually providing, which are consulting management and HR management. So now PHG, we metamorphosize into something else. Per se, it's not 100% healthcare related, but it's more consulting or business or administration management related. But it is for the healthcare industry, which is for healthcare facility. So that's how these few businesses came from one to another. So one lead to another and one lead to another. So this is how it went through for the past few years.
Wow, it's a very, very impressive journey. Like, it sounds like you just took a step and explore, and then, oh, this works, and try, let's add on and add on and add on, and grew to the size that you guys are now. So, like, how would you correlate, or what sort of experience you think you took with you from your clinical practice to running healthcare management and all your businesses?
I think the clinical experience relates very well to the businesses and the management that we do. Essentially, we are running healthcare business, and our clients are patients. Right? So when we see patients, we can relate directly to how business is related to their disease and illness, etc. And when we make a business decision, we will have to take into consideration our clients, our patients' point of view, rather than just P&L, profit and loss, how much money we want to make or how much money we want to lose. So business decisions was not based on P&L. It was based on rather the need of the local population. So we ask ourselves, these are the need, and as doctors, we will know, we use our clinical knowledge to decipher, how many hypertensive patients or how many people of the older generation, like the more than 60 years old. So we know that those are more than 60 years old, they are prone to a certain illness, chronic illness, etc. And screening businesses will benefit them. So we start by screening businesses to meet the need of this population. So we relate and when we connect between clinical related matters to setting up businesses, healthcare businesses. So that's how I relate it.
Okay, so what do you think, in your opinion, what do you think that makes you successful? Because learning about running businesses, even if it's just a GP clinic, this is something we're not taught in medical school or even our training in KKM. Nobody teaches us how to start a GP clinic and how to run it, right? So what do you think that, how did you become successful in this? And if, say, somebody wants to run a GP clinic, what do they need to know so that to ensure that, the clinic or the business thrives and succeed?
I think the most important thing that doctors need to know when they want to start GP clinics is to know what they are getting themselves into. They need to know their reasons, their why, and their objective. Why they want to set up a clinic. Is primary care or is general practice their cup of tea? Will they want to continue doing this for the rest of their lives? There are a lot of us, when we started off young, we never had an end in mind. We just do it just because others are doing, and because we thought that there are no other stuff that we can do when we are doctors, right? And so we just rush into it and then start it hoping that it will survive. So I think that is not a really right strategy, because obviously when we start off, we do not know what is going to come against us, what are the problems that we will face, and essentially it is not only patients' problem that we have to solve. We have to solve our own financial problems, sustainability problems. We need to solve human resource problems. Sooner or later, we'll find out we have somebody who decided to resign on us, or last minute, or sick, or things like that. Those are considered really petty stuff, but we were not taught how to manage people. We are taught how to manage disease and illness and prevent them, but we are not taught how to manage organization and manage people. So that's what is lacking for us as clinicians. The communication skills, of course, is most medical school teach communication skills, but in actual fact, a lot of us can't communicate very well with our patients. The skills that we have do not really it's not really adequate when we want to get our patients on our side, or get our clients on our side, not really patients per se, because sometimes we have non-patients client as well in clinics, right? And so a lot of doctors will struggle in that sense. So how do we tackle that? I think the best way to tackle that is to get a mentor, get somebody who has done it before, who are currently successful in the things that they are doing right now, and learn from them. Ask them, look, how do you tackle this? How do you tackle that? What will you do if you come across these problems? Or what will you do if you have a staff that decide to resign on you within 24 hours? Or what would you do when your staff starts stealing stuff, in your clinics, and they start losing lots of money? And how can I advertise my service? How to tell the whole world that I am doing such, and for people to come. So these are things that books and university doesn't teach us, but people that have done it before can tell us, that can teach us. So therefore, I really believe that all of us who wants to embark into the entrepreneurship minds or program or world, we really need to have good mentors to help us to decide, to tell us whether we are in the right track. And mentors are not just somebody by name, a lot of my friends said, I found my mentor. I said, oh, okay, well, who's your mentor? Okay, person A, person B. How frequent do you see the person? The last time I saw the person was about 5 years ago when we were just WhatsApping on the phone. So essentially, those are not the mentors that I'm talking about. The mentors I'm talking about are those that we talk to each other. I talk to my mentor on a yearly basis. On every year, I talk to them face to face. Tell them over a period of hours and hours about how my business is doing and how their business are doing, and how I can learn from them, and how they what's the advice they can give me so that I can be better. They a lot of advice we were surprised at a lot of stuff that they tell us that we have not seen before and we have not heard before. And so I think that's one of the important successful point.
Okay, I I completely agree. This whole upskilling thing, it's not really emphasized in our medical career. It feels like, just go for some courses to collect CPD points, go for CMEs, but the gist of it, you don't take away the main thing. It's really to upskill yourself. I also never I never understood the concept of mentoring while I was in clinical medicine. But the minute I left clinical medicine, I have so many mentors. Okay, I rock climb all the time, right? I don't do it so often now. But even for rock climbing, I have a mentor whom watches me climb, and he tells me, okay, you got to move your foot here, move your feet there. He gives me all these pointers to be better. Even running a business also, I have mentors who tell me, okay, maybe you can try this method. How to handle your staff, how to run meetings. They give me a lot of pointers how to be better. So I think also probably, those in clinical medicine can still learn to adopt some of these things that we do outside, right?
Yeah. I think there's a need for some certain people there's a need for people to let them know that the world outside is significantly bigger than what they think it is. What I thought the world is actually very much different than what we are experiencing now. And I believe that I have not experienced the potential fully as of now. And there's lots of other potential. So instead of keeping ourselves in one place and not moving out from our comfort zone, we need to really move our butt, start going somewhere, talk to people, see as much people as possible, and to gain to gain good networks, and along the way, who knows, we can find one or two good mentors.
Yeah, exactly. I think that's why Medic Footprints, we are building this academy for all the upskilling courses and we're putting mentors on the platform so that,
Mm-hmm.
the members can access them easily. So what is your final advice for doctors who want to transition out of clinical medicine? What's your advice for them?
I think the advice is being true to yourselves and find out your why. I mentioned earlier, get an objective, and if the why and the vision and the objective is really strong, right, it will not make us back off. Right, so we really need to be focused on the reason why we are doing that. When we want to transition out from one place to another, whether it's clinical to non-clinical, or from one non-clinical to another non-clinical. So it's actually a transition. So we have to focus, keep our mind focused on the place where we want to go, and of course we must have really the end. Why we are doing this, and where do we see ourselves in 5 years, 10 years, 15 years, and 20 years? I always ask myself that questions year after year, and I always ask and see whether I have achieved what I wanted to be. So that's first. The second, of course, being very patient. Patience is the greatest virtue. Now, I like in clinical medicine, when you have patients with high BP, right? You give antihypertensive, you expect the patient's BP to come down immediately, right? But in reality, in management or in business, it doesn't work that way. Now, each management process change will take months, the quickest to see certain fruit, certain change to come out. So, of course, during good times, whatever business that we invest in will see some money back only after a year. All right. Generally, in medical clinics per se, it will take 2 to 3 years to break even. Retail pharmacy take 2 years. Some faster, some 18 months to break even. So hospitals even longer, because they're quite big, 3 to 5 years to break even, to achieve the ROI. So we're talking about years, not minutes, when we give antihypertensive to hypertensive patients. So therefore, we need patience. So when we start something, we don't see fruit in the next 6 months. We don't see fruits in the next 1 year, perhaps in 2 years. But after 2 years, you still don't see fruit. It's time to change that. So don't keep there forever, But things the fruit will come up only much later compared with clinical medicine. So be patient, be very patient.
Okay, well, I think that's all we have from Dr. Paul today. Thank you, Dr. Paul, for being here. Thank you guys for tuning in to the episode of Post Call Beyond the White Coat. We hope you enjoyed our discussion with Dr. Paul Chan. I hope Dr. Paul's journey from clinical medicine and public healthcare administration to healthcare management and entrepreneurship is a testament to the importance of knowing why you want to do what you do and having patience. We hope his story has inspired you to provide insight on how you can make a career transition. So remember to follow us, and thank you for listening, and we'll see you in our next episode.